Welcome to Three Questions With, a program by the Latino News Network produced in collaboration with CAN TV. LNN is dedicated to best serving Hispanic Latinos with local multimedia news and information websites across the United States, including Illinois Latino News, a statewide community-focused initiative. Three Questions With is a public affairs program elevating the voices and visibility of matters most important to the Hispanic Latino community by speaking with community and industry thought leaders on the social determinants of health and democracy. I'm Hugo Balta, publisher of LNN, and your host. Across the U.S. and Illinois, COVID-related hospitalizations are up. Earlier this year, the Biden administration ended the public health emergency for COVID-19. But while for some the emergency is over, for many the risk is as real today as it was at the beginning of the pandemic. For Latinos, the impact was disproportionate. Many in our community are essential workers and had to work even during the lockdowns. Working to ensure Latinos aren't being left behind in public health and beyond, then and now, is Illinois Unidos, a coalition of more than 150 healthcare workers, policy advocates, representatives from community-based organizations, and elected and appointed officials. Alejandra Ibanez, Executive Director of Illinois Unidos, is our guest today. Alejandra, welcome to the program.
Thank you. Great to be here.
Thank you. Now, while public policies must be fair and equitable to all, early on, and I would argue to date, resource allocation decisions in the case of COVID weren't equitable. Latinos, the community most negatively impacted by the pandemic, weren't receiving the necessary resources proportional to the devastation. This is when Illinois Unidos comes together. Give us a little bit of history background about Illinois Unidos.
Sure. You know, I think it was just maybe 2-3 weeks from the point of the state of Illinois having a shutdown, which was the middle of March, because of the pandemic, that Illinois Unidos really came together. It really was a coming together of Latino healthcare providers, folks on the front line in the emergency rooms, also public health leaders, folks from nonprofit community organizations, even workers' rights groups who were really concerned about the community and probably their own family members, because this war on communication about what COVID was, we were losing. Mis and disinformation was really winning that strategy because there really wasn't good coordination or linguistically appropriate or culturally competent information about COVID-19. People really thought that they were going to get a chip in their arm when they got the vaccinations. And so, this group of community folks came together to form Illinois Unidos to advocate for the equitable response and recovery and community health education for the state's Latino community. It was really like a rapid response.
One of the things that I noticed early on during that period, and understandably that there's a lot of chaos, but one of the missteps in the beginning with local, state, and federal government was not reaching out to organizations that are embedded in these communities, that really have the relationship and can really help government understand the situation and where to provide those resources. How was it in the beginning for Illinois Unidos to engage with then Mayor Lightfoot and, of course, Governor Pritzker?
Yeah. I'm so glad you asked that question, because I really believe in co-governance, and unfortunately, a lot of our communities, like the Latino community, the Black community, there isn't a lot of trust in our community with government or even with, health institutions. And so really, government needs to really partner with those community organizations who have built trust. That's how we close those gaps. And so at the beginning, it wasn't as easy, I would say, because, the governor, mayors, different government leaders, they're seen as the experts, like they know better. But it became very clear, very fast, that there was a lot of learning and a lot of unknowns with this pandemic. I mean, there's still so much that we are still learning about COVID and about long COVID. And so when those government institutions realized how hard it was to really connect with hard to reach communities like the Latino community, they really then came quickly back to say, let's partner. We need you. We need each other to be able to be responsive.
Now, you mentioned that part of the barriers that Latinos faced in getting information was language. Información en nuestro idioma.
Exactly.
To sift through some of that misinformation. Yeah. A big misstep, especially when we saw that even though the city, the state, the country was shut down, Latinos were keeping the country running, right? Yeah. The essential workers, right. Keeping the country running. Can you share with us a little bit about being that middle person, translating some of this information, right. and again, getting local state government to provide these same resources that they had readily at hand in English in Spanish?
Right. Yeah. It was really a great opportunity, I would say, for us to lift up all levels of expertise and talent that we know exists in our community. So yes, we worked with doctors, we worked with researchers and Latino scientists, but we also had to work with our community health workers because they too, while they may not be highly credentialed, they have built trust in community. And so we really took this approach that we would bring together all levels of expertise, and we worked with both our Latino doctors, Latino nurses, and we brought them together with our community health workers because those community health workers were out in the community. They were hearing it directly on the street, on their block, about what people were saying, people's misperceptions, people's fears. And so it was really this beautiful coming together of our medical experts with our community health workers that we call promotores de salud in Spanish. And they together were able to craft both information that was scientifically appropriate and accurate, along with the cultural competency, and I would even say the linguistic expertise, because sometimes you can't even you wouldn't even use academic Spanish. You want folks to be able to look at a flyer. It has to look nice, but it also has to be something that I can understand and I can access, whether I have a 6th grade education or I have a college degree. And so for us, that was what I call the magic sauce, right? The secret sauce of bringing our experts who are the medical science experts together with our community experts. And that's how we were able to create infographics that really resonated with people and that people were able to connect to. And for us, it was about really digging into our own community talent and expertise and getting rid a little bit of that, these concepts that community folks don't know better because they do.
Absolutely. And building those bridges are key. And as you mentioned, promotores were very crucial in the beginning and continuing to do that work.
Absolutely.
So now let's transition to 3 years later.
Yeah.
You mentioned long COVID.
Yeah.
Tell us about that.
Yeah. So what we're learning from the science and unfortunately through the lived experience of folks with long COVID, this is the chronic side of COVID, right? And so millions of people have gotten COVID around the world. But what we didn't know and what we didn't expect is that there would be a chronic side. And so what long COVID is, there's over 200 symptoms that have been found that many people who had serious COVID, who got COVID very early on before vaccinations were out, when they were hospitalized, then have continued and new symptoms. And so there are thousands of people today in the U.S. anywhere from 15 million to potentially 40 million people who have had or currently have long COVID. We don't know if this is short-lived. Does it last 3 months? Does it last 6 months? Some folks, including one of my board members for Illinois Unidos, has long COVID. She is a CEO of a home health care agency. They serve the elderly who receive Medicare and Medicaid. And she, a very healthy 50-year-old woman, now has over 13 long COVID symptoms. When she was absolutely healthy beforehand, she got COVID very early on because of her work, because she works in healthcare, and is doing her best to work. But she's got brain fog, her lungs are damaged. Now they're starting to find that she's having issues with her kidneys. And so we are unfortunately learning this as we go. And so it's a very scary thought that we have to learn this way. This is a brand new illness. Many people may have long COVID and don't know it. Doctors have not been trained in this illness. It's a brand new illness. I mean, we now are talking about how do we educate and prepare healthcare providers to even identify COVID, and what are all the different kinds of specialties in health that maybe long COVID patients will need. Because it's not just only brain fog, or it may not be just your lungs or your kidneys. It's a multi-organ attack that impacts people in different ways.
You mentioned there's still a lot that's unknown. And almost to the day, 3 years later, the Biden administration declares COVID no longer an emergency. And soon after that, Governor Pritzker eliminated made it much more difficult. These Medicaid-like programs
That's right.
that were established by the Pritzker administration almost ceased to exist. Now, we know that even though the emergency is quote unquote over, for the Latino community, it's still very much an emergency. Fewer resources for them, still a lot of unknown. What are your thoughts about where we are right now in providing the most vulnerable with resources to continue to combat this virus and continue to be treated?
Yeah, it's really unfortunate. It's heartbreaking, especially as you shared, Hugo. In Illinois, Governor Pritzker had been an incredible advocate for the creation of a Medicaid-like program for immigrants in Illinois. I mean, in the state of Illinois, immigrants contribute over $7 billion to the economy, but they are still ineligible, as they are in the entire United States, to have access to Medicaid. They are not allowed to access federal supports. And so it was just a few years ago that Governor Pritzker supported an idea that came from community to create a Medicaid-like program for immigrants, recognizing their contribution and the fact that healthcare should be a human right. And so that program still exists today, but the applications have been closed. So since July 1st, no new individuals are allowed to enroll into this program. And so that for Illinois Unidos is, again, heartbreaking and devastating, because the recovery of COVID is not over. Now with long COVID, for those who have survived, if they are immigrants, they will not have access to health care. And, as we were sharing before, a lot of folks don't have trust in healthcare or in government, but they're also very fearful of the unknown. And so many folks are not even aware they have long COVID. And so this has huge implications for our economy. It has huge implications for the health and sustainability and the economic sustainability for all people in the U.S. and Illinois. But I would say for Illinois, for Latinos in Illinois and other essential workers that find themselves in low-wage work, their recovery is going to be completely hampered. They are not going to be able to continue to impact the state's economic labor force or work for themselves because they don't have access to health care. So it's heartbreaking. It's also unacceptable. And it's too bad that it's been politicized as it has.
Yes, very unfortunate. Still a lot of people suffering, a lot of more work to be done, and certainly Illinois Unidos is leading that effort. You are watching Three Questions with Alejandra Ibanez, Executive Director of Illinois Unidos. When we come back, we're going to get a little personal. She's going to share with us her lived experiences as a child coming to America.
I'm Jamira Alexander, inviting you to join me for Public Narrative, A Word, with my very special guest, Dr. Michael Spikes of Northwestern's Medill School of Journalism and Yanti Freesom of Columbia College, Chicago. Join the conversation Thursday, September 28th at 7 p.m. on CAN-TV Cable Channel 19 and streaming on cantv.org and the CAN-TV Plus app. Experience the power of community television.
You're watching Three Questions with Alejandra Ibanez, Executive Director of Illinois Unidos. We've talked about the work the organization is doing, continues to do in providing education and resources to the vulnerable communities that are still under the thumb of COVID-19. Now, Alejandra, we're going to get to learn a little bit more about you. You came to the United States as an undocumented immigrant child with your parents, with your brother. Share with us what normally often is a sort of ups and downs of being an immigrant in the United States.
Sure. Yeah, so my family arrived in Arizona when I was about 5 years old, right? So I was actually born just days after 9/11, which was when the military regime took over in Chile. And so really we left for political reasons, but we were not official political refugees. And so we arrived with what we say in Spanish, our maletas. You know, we had just enough clothes as if we were going on vacation. And it was really about being able to stay safe. My mother really feared us staying in Chile. She was very outspoken. It wasn't well received in the family, but it was dangerous in Chile. And so the U.S. really provided an opportunity to be safe. She was used to living in a democracy in Chile, and that was lost. And so coming to the U.S. was a way out and a way to stay safe. But it wasn't easy. And I'll tell you, for many years, I didn't even realize I was undocumented. And my mother really did not share too much about Chile. I came to learn years later about just the trauma that she experienced and had left behind. But things were really hard. My mother was college educated, but because she was undocumented, wasn't really able to, live out her dream of being a Spanish professor. She worked in factories. In fact, my mom worked 3 jobs. She delivered newspapers. I think she delivered the Wall Street Journal in the morning. She cleaned houses, and she worked at a factory. She's told me stories of when she worked at a factory and immigration, that's what we would call it as kids, came to check up on workers to see if they had legal papers. And my mother did not. And so she was told to jump out of a window. And so as a young child, I didn't quite understand what was going on, but I came to learn through my mother's lived experiences of how hard it was for her to find work. My parents eventually divorced when I was about 12, and my mother was found to have cervical cancer when I was about 13, and she didn't have access to health insurance. But my mom was able to get the care she needed through what I think was a federally qualified clinic. And those were the community organizations that were there to support those who didn't have access to health care. And we moved around a lot. My mom had a hard time finding work. So we went from Arizona to New Jersey. So we moved to New Jersey when I was a second grader. And then we moved again to Chicago when I was a sophomore in high school. Because, again, there was limited work for somebody that was undocumented. Luckily, we were able to get support to apply for our residency. And actually, that was with the Catholic Charities, again, a nonprofit who was there to support us. And my mother is a very prideful woman. She never wanted to ask for help. But I'm glad that she did, because our lives changed drastically when we became legal permanent residents. I became a legal permanent resident in high school, and I became a citizen when I was 20 years old. I was able to go on to college. I now have my master's. I've done work in the Illinois state legislature. So it's been full circle, but I think my lived experience really helped me see the difference in the quality of life from being both an undocumented immigrant and then being a legal permanent resident and a naturalized citizen. I have a good quality of life. I'm now married with a public school teacher and have 3 children who are thriving. And so that really taught me a lot about what's fair and what's right, and the quality of life that we all deserve as human beings. Because the reality of immigration is not just in the U.S., it's throughout the world.
And thank you for sharing that. And I think listening to you share your story, those lived experiences, it's very easy to see what inspired you to do the work that you're doing with Illinois Unidos, and before that, to be able to, because you know what these people are going through.
Right.
So many years later, from what you experienced with your mom and the bouts of cancer and poor access to healthcare, if healthcare at all, has much changed since you came here as a young child to now as an adult leading in this work?
I don't think so. I think we've been able to impact and improve certain policies, but we continue to have millions of immigrants who came here to work or to escape political unrest. In fact, now Chicago, like other states, are also dealing with political refugees from Venezuela and throughout the Americas. And so some things haven't changed. I feel very privileged and lucky that if it was not for the amnesty of 1986, I wouldn't be in this situation where I actually am now college educated, fully bilingual, right? I'm able to raise children and be able to give them all the rights that U.S. citizens have. But those rights to healthcare, to education, are things that all humans should have access to.
Alejandra, thank you so much for spending such great quality time with us today.
Thank you.
You've been watching 3 Questions with Alejandra Ibanez, Executive Director of Illinois Unidos. When we come back, La Última Palabra on COVID vaccines and staying safe.
It's been said that all politics is local. Well, I say all news is local. Join me, Andy Zopp, every week for conversations with local journalists and concerned citizens to discuss the news of the day, how it's being reported, and how it impacts the lives of Chicagoans, right here on CAN-TV 19, streaming live on cantv.org and on the new CAN-TV Plus app.
And now, La Última Palabra, the last word on COVID-19 and staying safe. Because COVID cases and hospitalizations are no longer leading newscasts on TV or making front-page news, many Americans might have a false sense of security. Still, Latinos have reason to be concerned. COVID-19 devastated Latino communities, exacerbating existing health and economic inequities that resulted in fatal consequences. In a health policy think tank KFF survey, Latinos with lower incomes were more likely to express concern about the Biden administration ending the public health emergency than white Americans and households with higher incomes. A new round of COVID vaccines is being made available. Vaccines have been highly successful in serving millions of lives. Despite their effectiveness, there has been a particularly polarizing public response to the COVID vaccines. According to the publication Stat, only 30% of Americans are fully vaccinated and boosted, and 20% of Americans have opted not to get vaccinated for various reasons. Latinos in particular have historically had a mistrust of public health authorities, and many are more likely to be wary of vaccines. Improving the COVID-19 vaccine uptake continues to be a critical line of defense against the virus. Over the summer, my family organized a reunion in my Chicago home. People came from different states and abroad. The celebration quickly became an emergency when 7 family members, including my daughter, wife, and myself, tested positive for COVID days later. My mother-in-law spent nearly a week in the hospital with respiratory problems. It was the first time for everyone. The moment we let our guard down was the moment we contracted COVID-19. Take it from me, it is crucial to remain vigilant, continue following local public health advice, and consistently maintain individual practices to protect ourselves and each other from COVID-19. And that does it for this edition of 3 Questions With, a collaboration with Illinois Latino News and CAN TV. I invite you to look us up on our websites and chat with us via social media. Tell us what you think about the topics we talked about today, and please send me suggestions about what you think we should talk about in the future. Because at the Latino News Network, you are more than just our audience, you are our contributors. I'm Hugo Balta. Thank you all for watching.